Hello, I'm Dr. Mark Stoebe. I'm a chiropractic orthopedist in Great Falls, Montana, and I'm going to discuss the use of Cluffy wedges with patients, how we can help people get better quicker. In our clinic, we used selective functional movement assessment, or SFMA screens, with every patient, both when they're new as well as for follow-up visits. In doing so, we're able to watch our patients functionally move, which we know is more important than structure when we're working with trying to help orthopedic injuries, or whether they're just chronic problems that have come along. Too often, I think, our focus is on where is the sore spot. However, when we do that, we often miss the cause of the problem, which may be the foot, the large toe, etc. This is Nikki, she's our clinical director. We're going to put her through certain motions that are standard motions with this method of analysis so you can see some of her problems. So face me squarely, Nikki. Hold your feet at shoulder width, elbows at 90 degrees, press straight up, and do as deep a squat as you can comfortably do. So if you look at her, her motion actually isn't too bad, but she lacks a little bit of dorsiflexion in the left greater than right ankle. In the foot, kind of like in the hand, the thumb and the large toe are more than 50% of the function of each extremity. So the way they work or don't work has a huge impact on how our body moves. So we can acquire hip pain, back pain, even neck pain from feet that don't and ankles that don't move correctly. This Cluffy wedge device significantly helps most people's large toe function better and therefore helps a lot of what we're working on. We'll do one more screen. Nikki, put your feet together. Rotate your trunk one way as far as you can go. 110 degrees is normal. That's not too bad. Now the other way. We can see that she doesn't rotate to the left as good. So what we're going to do, we're going to take her out into the hall and watch her walk for a little bit first without the wedges. So we're now placing the wedges, and what this does is allow the large toe to extend better. If the large toe does not extend 65 degrees, the lower extremity will not function normally. We should be able to notice as she walks that her stride will be a little bit more symmetric. The other thing that we could see before we put them in is she was really lateralizing on her left foot. She had a little bit of external foot and ankle rotation. She was also pronating. She's still doing a little bit, but much better than before treatment. Her gait's a little more symmetric and the left side is much improved versus pre-placement of the wedges. Now we'll revisit the squat test. Stand with feet shoulder width, arms in that position. Now press straight up and deep of squat as you're comfortable. Okay, back up and do it again. We can now see that her left ankle has much more symmetric dorsiflexion. Her pelvis is shifting to the right less than it did before we placed these devices. Now put your feet together, arms at your side, rotate all the way to the right, which is about normal, and now to the left. We can see that that's improved almost 30 degrees. That's pretty significant. So it's interesting that these devices, you'd think that they're primarily helpful with flexion and extension, but yet they even assist rotation. For those reasons, we find them very beneficial to use with people that have foot problems that are contributing to ankle, knee, hip, or low back problems. We get better results quicker, faster, and for very little extra cost. So for that reason, I strongly recommend these devices.